had pain since about 2011, and I think some of my pain really stemmed from trauma, right? I had a traumatic event when my mother passed. She passed sudden. I was the one who found her, and that really put like a stiffness within me. There, over the period of years, I saw chiropractors. I had a car accident when I was 18. I could even go back to when I was a child. Different things that happened with me that I didn't really understand was impacting how my body operated. I was an athlete. I lifted weights. I exercised a lot. So I felt, okay, these are just growing pains, right? So you keep moving forward thinking this is just normal, but you start seeing, I started with a chiropractor. I had a chiropractor since I was in middle school for my knees, and I grew 5 inches, and they told me I was having some growing pains with the growth shaft in the knees. So then it started with, I would have, and this is as a teenager, right? And by the time I was in high school, there were times where my kneecap would come out and I would have to carry a cane sometimes to go to school. And then as I went to college, in my first year of school, I was swimming. I got in a car accident, and the car accident had me ejected from the car. I do not have memory of the accident because I blacked out. However, what I was told is that I was ejected out of the front of the vehicle and I was hit by an 18 wheeler on the right side of my body. So I always had issues with my peripheral on the right side versus my left side. I could always tell that difference. But again, after going through physical therapy, chiropractors, for several months and traction and all of these things, you think that everything is going to work out just fine. So as the years go on, I've had children and had pain in my back and always thought it may just be, again, from growing pains, just your body going through different things of life. And you would go to the chiropractor, you would go to a physical therapist. I've seen spine doctors, I've seen back specialists. I moved to Maryland in 2014 and I saw the best back doctors, back specialists in Johns Hopkins where I worked, and no pain relief, only medication and some treatments and some adjustments, and you get slight release. So when I relocated to St. Croix, fast forward in 2023, I had a physical therapist tell me some of this pain may be emotional. And I was certainly going through a lot of not just physical events, but I also had a lot of emotional events as well. So there was a compounding effect going on with me. And in 2023, I suffered the most, I think, where my body just felt like it was numbing itself. I would have pain all over the place. I was even taken out of work for a little period of time just because I had struggles moving and having just basic mobility. And so I started seeing a physical therapist. I started getting back adjustments with a chiropractor again over the last 15 years, really trying to get some significant relief so that I would never be in pain, right? I've always had to take some kind of medicine or to use some kind of topical cream that would numb or give me some kind of relief. And so when I stumbled upon Mr. Poncelet, I said, why not try this? I heard someone in a training saying that they received some relief from someone in their knees. And I was like, I want to know who that is because I have pain in my hip, my back. I would love to meet that person. And I didn't think anything of it, but that person reached back out and Shankar Poncelet followed up with me on Instagram. And I was like, okay, this is for real now. I was like, so you can help me. And I took a leap of faith. I can tell you, being someone that had tried everything for a long period of time to be out of pain, I was willing to do anything. And I took a leap of faith and I told Shankar, I said, it's not just me. I have a sister, a twin sister, who's also suffering with rheumatoid arthritis and Papa syndrome. And she's quite swollen and in a lot of pain, a lot of discomfort as well. And if there's anything that you could do to help us, I would really appreciate it. And he was like, I'm in San Antonio. And I was like, I'm in St. Croix. I don't know how this is going to work. And so he was like, we can talk over Zoom and we can see how we can help you. And I trusted that process. And I met with him and on a Zoom call, the experience that I felt was my pain literally disappearing within minutes. He follows an evaluation, and in that evaluation, he's testing to see how your body's operating. I started to notice that my peripheral was aligning on the right side, on the left side. That was the first side. And so as I kept going, I noticed that my pain was shifting. And my pain was reducing in its degree of severity. All of that to say that I felt that my pain at that point was about an 8 or a 9, went to about a 3 or 2.5. And that was pretty phenomenal over a Zoom call. So I said, is it possible for you to come to St. Croix? He said, sure, I'll come. So I was like, all right, I'm going to get some arrangements and talk to my sister. And my sister flew down from Maryland, and also my daughter, who also has some menstrual cramp issues, and we got three of us together. And I said, we'll just try it because I'm trying to explain to everyone what I experienced, and trust me, just trust me, this is going to work. I'm really feeling this in my heart. And I shared some of this with Shankar, and I saw my sister be healed. All of her swelling in her wrist and her ankles and her neck disappeared in front of my eyes in about 15 to 20 minutes. I saw my sister rotating her wrist for the first time in months, or in probably over a year, and she's on heavy medication. And I saw my sister able to lift her legs in ways that she hadn't been able to do in a long time. And then I had my reset as well. And I both of us experienced being pain free in one session. So that was transformative for me. When you're going through pain from a child to all the way to I'm in my late 40s, and you've tried everything you can think of. I can't even tell you the ticket that I've spent with and without insurance, because some things you're going to get some insurance relief, but other things you're going to have to make a decision to prioritize on your health to pay for it. And in doing that, I saw that shift, and that leap of faith worked for me. And so I decided this was something that I wanted to share with the community, because in that process, you're going through an evaluation where you speak about your trauma, you speak about all the things that has ailed you over the years. And then he follows a process where he's using a tuning fork in the center of your head. He is assessing the strength of the body throughout the body. And then he's doing a reset where he taps on your nose, and that evaluates like the release of that trauma in that particular area. And in that evaluative process is where I saw the relief literally occur right in front of us. And so this is why I needed to share that over 20 years, 15 years of real chronic pain just disappear. And I am able to restore normal activity for basic things that I was told to stop doing, like walking. Okay. So this is why I wanted to share my story with you. So thank you.